Welcome back. Now, this particular vignette is going to be fantastic, but it couldn't be brought to you without the generous sponsorship of ChiroOne Wellness Centers. ChiroOne Wellness Centers offer a very unique approach to custom chiropractic adjustments and active therapies. They're there to help relieve pain, improve physical and neurological function, and enhance overall wellness. They have over 150 clinics across multiple states, and they provide convenient access and accept many insurance plans to make care more affordable. ChiroOne's mission is to create a nationwide network of wellness centers, making chiropractic care an essential and trusted part of every community's healthcare journey. Their vision is to inspire and empower people, just like we talked about all weekend long, so they can heal, live, and function better. If you want to learn more about ChiroOne, you can go to chiro1.com. Last year, during the BioFreeze USA Pickleball National Championships in November, the foundation aired the pickleball commercial 20 times. This was aired on the Tennis Channel, ESPN, CBS Sports, and other connected TV networks about how chiropractic care can support senior living and active lifestyle. In case you missed it, here it is.
My husband and I are able to play pickleball with our grandchildren because of chiropractic care. It has given us the keys to a healthier, more active life. Chiropractic adjustments help us prevent injuries and keep on top of our game so we can enjoy every moment with our grandkids on the court. Visits ease joint pain, enhance flexibility, and even improve balance. Gain more freedom and joy in your daily activities on and off the court. To find a doctor of chiropractic near you, visit f4cp.org/findadoctor.
We're very excited to welcome Dr. Matt Antonucci. Dr. Antonucci is a board-certified chiropractic neurologist and a 5 specialty board-certified fellow in functional neurology with nearly 15 years of clinical experience. Now, as a researcher and international lecturer, he specialized in concussions, but has also helped patients transform the health of thousands with complex neurological conditions and performance challenges. He does this through his tailored brain rehabilitation programs. A highly sought after speaker, Dr. Antonucci has delivered thousands of hours of education to healthcare providers around the world and has authored several peer-reviewed publications. He is also a very devoted husband and a proud father of 5 boys.
5.
Wow. That is inspiring. All right, well, let's introduce and welcome Dr. Antonucci.
Yeah.
Thank you for being with us on ChiroThon.
Yeah, thank you so much for having me. I'm so excited because this is a great opportunity to share a whole bunch with a lot of people and kind of let people know what the importance of chiropractic is and how much we can actually help, especially people with neurological problems.
It's beautiful. Now that I know you have 5 boys, there is nothing like a dad that has 5 boys to talk about this topic, okay? Because it's dear to my heart too, having a son that has sustained a concussion. But I want our listeners to really understand, because it's changed over the years. First, start off with what actually is a concussion.
Oh my goodness, that is a loaded question. Actually, the world doesn't even know. There are 30 definitions of what a concussion is.
Wow.
30. And nobody can really agree upon one single definition. So we're working on that, but here's the take home. A concussion is an alteration in brain function after a trauma. That's the easiest way to understand it, and that's a very, very broad definition because concussions are very broad. I mean, many things can manifest from them.
It's very difficult for someone when you say there's 30 definitions, and you know the person sitting watching today, which I appreciate you joining us, it often doesn't hit home until it actually happens. Sure. And then you're kind of flat-footed. So, you know, where do I go? Who do I see? And how are they going to help with my son or daughter or myself, help with what has happened? And they labeled it as a concussion, and now I don't know what to do. So when one starts with the diagnosis, how does chiropractic kind of fit into that concussion treatment guideline?
Yeah, and that's a really important question. I guess the first thing is that we have to know when it occurred. So there's so many myths out there, and kind of like old wives' husband tales, whatever you want to call them, where it's like you have to lose consciousness to have a concussion. That's not true. Only like 8% of all concussions lose consciousness. Then there's other things that are saying like, oh, if you have a concussion, when people go to sleep, don't let them sleep throughout the night. You have to wake them up. That's not true either. So there are so many myths that need to be demystified, if you will, or re-explained, and in order for us to understand where chiropractic can actually fit in the continuum. And I think that's a really great transition point there, because if you think that somebody hit their head and you think that they're acting different or feeling different, assume that they had one. Even the research supports that. It's impossible to rule out a concussion if somebody hits their head and is feeling different or acting differently. So if somebody's more sleepy, if they're a little more anxious, if they have a headache, if they have neck pain, if their balance is off, if they're talking funny, if they're more irritable, the first thing we need to do is bring them to a healthcare professional, and that's probably where chiropractic fits right in. And the reason why I say this is that chiropractic is a very unique position inside of the healthcare profession.
Right.
And very unique people go to chiropractors. The people that go to chiropractors trust their chiropractors. They love their chiropractors. They see them multiple times a week in some situations. And it's not that they don't trust their medical doctors, but typically they're going once or twice a year for their annual physical or for when they have a big problem. So chiropractic is perfectly seated to be the primary intervention, or at least the primary identifying point for patient cares with concussion, because you hit your head, you're probably going to see your chiropractor in a couple of days anyways, so talk to them about it. And the important thing is that one of my missions is to educate as many people in the chiropractic profession as possible about what a concussion is, and for the doctors, what do we do about it?
Excellent. What do we do about it? So, for example, a parent, and you just talked about some of these really important myths that really do, like, it's hard to break these myths down. It's like, wake the child up, wake the child up, the child's trying to heal. The child's trying to heal the brain, and we're waking them up. And then we're like, well, do they eat? Do they not eat? Like the myth, the old myth was, don't give them anything to eat. They need to heal their brain. And so these are some of the questions that I think really pose fear for someone who's trying to help their child, or an athlete who knows, hey, I hit my head pretty good. I got my quote unquote, my NFL player saying, got my bell rung.
Yep, exactly.
And so we see, and I've talked to several of them on the Adjusted Reality podcast, the NFL players that have sustained quite a few head injuries. If you were to stop for just a moment, and we'll just take it from a parent's perspective, your child has a concussion. As a dad of 5 boys, now he has elevated to like, wow, in my world. I have 2. What would be the first thing you're going to do?
Well, we don't have to make this hypothetical. So like I said, I have 5 boys. I have 2 sets of identical twins. And my little twins, my 6-year-olds, their favorite sport is motocross. Think about this. Like, they like riding dirt bikes, hitting jumps. My Ashton, who's kind of like out of the 2 younger kids, he's like the more aggressive one. Aiden's a little bit more cautious, like very meticulous about his form. Ashton, when he hits the top of a jump, we measured it 31 feet until his back tire lands. So he's cruising through the air and landing on these things. So this is not hypothetical. Those kids fall. It's part of the sport, is falling. And I think that this is a great talking point, because there's so much fear around concussions. Don't play football, don't play lacrosse, don't ride dirt bikes because you might get a concussion. Here's the reality. The research is pretty conclusive. By the age of 25, everybody on this planet has had 1 concussion.
Okay, out there, you just have a concussion, okay? You just got it down right here.
And if you didn't, there's somebody else that had 2 for you. Right? So when we start looking at the occurrence of these, it's equal to the population, because some people have 3, 4, 5, some people don't have any. But the reality is, it's not about how to prevent concussions, it's more so how to become aware of when it happens and what to do about it, because it's serious. Concussions are serious. It's a brain injury. And there's even some groups that are talking about taking the word concussion and eliminating it, because it makes it seem like it's not as serious as a mild traumatic brain injury.
Yes.
There's actually a lot of research around that kind of says, if you had to choose one of them, which would you rather be told that you have, a concussion or a mild traumatic brain injury? Everybody says concussion. But the research shows that the people that are told they have a mild traumatic brain injury follow their doctor's recommendations and report back to their doctors if they're told they have a mild traumatic brain injury, not with a concussion. So it's kind of semantics. But the question was, you're a parent of a child that you think or know just had a concussion. What do you do? As a parent, always bring them to the doctor. You might want to start with the emergency room first because there are certain criteria that are explained to doctors that they know when you need a CT scan and when you don't.
Okay.
The worst possible outcome of a concussion is having a brain bleed. And because those could threaten somebody's life. So you want to rule out that they don't have a brain bleed. And a lot of people get really upset when they go to the emergency room saying, oh, they just told me I had a concussion, go home and rest, right? But we have to understand where the emergency room is in the care continuum, and then we can talk about where chiropractic is. Because the emergency room is there designed to make sure you're not dying.
Right, live or die.
So people don't die from concussions. So you had a concussion, go see your primary care doctor. And your primary care doctor might be your chiropractor. There's a big poll, I don't remember that it was published, I don't remember the results of it, but a good deal of the population consider their chiropractor as their primary care provider.
Sure.
And then their medical doctor is their secondary care provider for when they need medications, when chiropractic is not working, so on and so forth. So go to your primary care provider as soon as possible and just let them know what's going on. And then somebody who's in that position as the primary care provider should be knowledgeable about when to intervene and when not. And also to give guidance. And then the next step would be, there's a series of things that you can do at home that are very beneficial. Research is suggesting that mild, subsymptomatic, meaning below your exacerbation or flare-up of your symptoms, aerobic exercise is highly beneficial to recovery, especially if it's done in the first 72 hours. So once again, there's another myth. Rest is best. Sit in a dark room until your symptoms go away. The research right now is literally in opposition to that. It's saying, get off your rear end, just do walking, some mild exercise activity, as long as you're not flaring your symptoms up, and that'll help. Drinking lots of water. Don't take ibuprofen, because
Don't take ibuprofen.
Yeah, that's a lot of some
Because
people
that's
go
a
to reach
myth,
for it.
right? That's the
you have
first
a headache.
Yeah.
Yep.
Let's get the inflammation down. Let's review all of the pain problems you have.
I know.
This is not a pain problem.
No, it's not.
This is a real traumatic brain injury, and
it's
it
not
needs
pain,
to
it's
be
brain.
cared.
Yep.
Yeah.
Yeah, and the reason for that is because ibuprofen has an increase in bleeding risk. So, there's all of these things that we can talk about, but I guess...
So that's really a good just right there, is getting moving, which was the whole being care model that we've been presenting all weekend long, and thank you for still joining with us because it's Saturday afternoon and we love having you. But one of the pieces that you just said that I think our audience needs to just reflect on, number one, we need to keep moving if it's appropriate and you've gone to your healthcare provider, because that really does change the game. Is what doesn't grow dies, and when you've had a traumatic injury, you want to be able to heal it. So listening to a confident healthcare provider to get that. Number two, that myth of give it an anti-inflammatory, not happening. But then on another note, is there something you would recommend, knowing that you want to speed up the healing, you're not going to take the ibuprofen? What would you recommend to our audience?
Yeah, so there's really three big things. I always say three take-homes. The first thing is don't get re-injured.
Okay.
All right, that's important. So part of the rest is best is to prevent what they call second impact syndrome. It's basically having a second injury while you still have first injury going on. That can be really bad. So don't get re-injured. Number two, we have to cut out our carbs. For the first at least 72 hours, really reduce the carbs, because for our people out there that aren't so familiar with like metabolism, stuff like that, basically your brain becomes diabetic after a concussion.
Got it.
You can't use glucose. You have to shift your fuel to fats. Okay, so get your bacon in, get your eggs in, things like that are fatty. And then the third thing is, like we said, just get a little bit of light exercise and see a primary care provider.
That's
so
beautiful.
those are the three big things: move, eat, and be cautious.
I like that. I think, any given day for me is move, eat, and be cautious.
I know, right? Let's follow the
it's a
rules
good
of
thing.
life here.
You know what I think has got to be amazing is your wife, because she's got 5 kids, boys, and this is part of their movement theorem, right?
Yeah.
They need to move. Get your boys moving, because that actually is what keeps them healthy, what keeps them strong, and they know they start to understand where their limits are.
Yep.
Their balance, their flexibility, their
100%.
mobility, but most importantly, and I think this is one of our themes, is capability, which is the ability to build muscle tissue. And you just talked about the brain. Most people don't think of the brain as a, quote, muscle.
That's right.
Talk more about that, the health of the brain, because that's what we're trying to heal.
Yeah, absolutely. Well, the brain is like a muscle if you think about it. Actually, everything in your body is like a muscle, because muscles are made of protein, and every single thing in your body is made of some sort of a protein, including your brain. And proteins, when they are stressed, become stronger, right? So when we start having something like a concussion, I think the first thing that we said, what is a concussion? A concussion is a breakdown in neurological function after a trauma. So it's like Humpty Dumpty falling off the wall and falling into a bunch of pieces. How do you put it back together again? The way we do that is just reintegrating sensory information in a very strategic way. And that's where chiropractic comes in, because one of the most important things about putting all those pieces back together is getting the eyes, the inner ears, and the neck to all work together. That's a really big problem with concussion. And if you were to go online and look through medical research and just zoom out a little bit and say, what's the big problem with concussion? Your eyes, your inner ears, and your neck stop working together. So that kind of creates this triad, of chiropractic, maybe some optometry, as well as vestibular PT, to create this perfect triad of recovery for people with concussions.
That's a very important point. I kind of think, since you have 5 boys and life is a little more jovial because they're energetic. As you said,
yeah.
Humpty Dumpty. I remember a chiropractic cartoon that my producer sent to me once, and it's Humpty Dumpty sitting on a chiropractic table, and obviously he has a crack as an egg, and the chiropractor goes in and goes, hey, no problem, we got you covered, we're going to be able to fix this. This is a superficial problem. Yeah. And he goes, but we do have to have a conversation about your cholesterol. So as we go through and we start talking about how the brain heals, and it's also very important for people to recognize that there's lifestyle choices that they make that really do impact their brain.
Absolutely.
And I will tell you, watching some of our sports chiropractors on the field and the stress, because you said something really important, a protein under stress grows. Mm-hmm.
Under enough stress, not too much stress.
Enough stress. It's kind of like a human being.
It's a bell-shaped curve, right?
Yep. It's like when we don't have the normal stress in our lives, are we growing anymore? And I think it's kind of like that proverbial, we all need to have the good stress in our life. And watching that chiropractor go out in some of the NFL, NBA, and I realized basketball is traumatic.
Huge.
Like that's
gymnastics and cheerleading is traumatic.
Those are key sports that concussions are real, and they're often, and we need to make sure that we're dealing with them. But the one piece that I wanted you to talk about, because most professional teams now have a chiropractor on their team.
Mm-hmm. Yep.
And is it different for an Olympic athlete in the healing process because of their optimum wellness and performance than it would be for, say, if I went and had a concussion on our way out, which I choose not to have.
Yeah, right. Good. Well, you should choose not to have one because they're really bad things. But so the answer is yes, it is different, because when you have a concussion, what you're doing is, if you had this performance continuum, where it's like death, optimal life, everybody sits somewhere on that performance continuum. And what a concussion does is, because the injury that occurs to your brain becomes less efficient.
Okay.
Right? So if you were less efficient to begin with, and then you go backwards on that performance continuum, it's going to be different than if you were a gold medal Olympian going backwards on the continuum. So the research, once again, I like referencing the research. I mean, that's one of the things that we strive for a chiropractic to be, is evidence-based. And in order to do that, we have to read the work of people that are doing the research. The evidence supports that individuals who are high-performing athletes or high-performance human beings heal faster than people that are low-performing humans. So we do take a little bit of a different approach. Those people do tend to recover a little bit quicker. They do tend to need less intervention than someone who is couch potato, watching TV, playing video games, eating potato chips, so on and so forth. So almost kind of like our 3 rules applied to life. People that have practiced those 3 rules will typically heal faster. People that don't practice those 3 rules, not moving, not eating, and not being cautious, they're not going to recover quite as quickly.
This is a fantastic piece for a Saturday afternoon, because what we're really trying to do is inspire you. And I know the topic of concussions can actually be really scary.
Sure.
And we're coming back to a common theme, that theme being that if you're in good shape or great shape, you're going to recover faster.
Yep.
And you're going to be able to handle the life stresses more effectively.
Absolutely.
And I think that's where I'm hoping our audience goes. And parents out there that have children, I hope we're taking some of the fear away from you to kind of be in that realm of what it is and why it's important to get treated. But when we talk to our chiropractic friends, and I invited a lot from the Sports Council, so I hope you're out there, and we thank you for joining, because we do have a really fantastic guest with us. What should chiropractors be cautious of when treating a patient with concussion, so that even if they're not chiropractors, they're hearing, what are we thinking as chiropractors when we see a concussion patient?
Great points. The first thing that we have to establish, is it a concussion? Right, because concussion can masquerade as many different things. It can masquerade as anxiety, depression, neck pain, nausea, like, oh man, I feel like I have the flu, right? We really have to understand if it is a concussion, because the reason being is that if it is a concussion, you're going to approach that patient very differently than if it was primarily a neck problem. And here's the thing with this. This brain sits inside of a head that sits on top of a neck that's connected to the body. And our head is much bigger than our neck is, so it's basically just out there wobbling around. We're like, almost like the bobblehead on the dashboard, right? And when we hurt our head, often we hurt our neck as well. And therefore, they may be existing together. So someone who's a trained chiropractor will say, I'm going to check out the neck, I'm going to check out the brain. I'm going to understand if it's both or one or the other, and then treat accordingly. And if it is the brain first, most of the time what we're going to do is give you the advice that I just gave you.
Yeah.
Right? Rest, aerobic exercise, drink, eat fatty foods, and just kind of take care of yourself for a couple of days, and not necessarily intervene with an adjustment or any type of physical therapy in the first, let's say, 72 hours. Because at that point in time, our brain is kind of like on fire, right? It's healing, there's inflammation, there's changes in blood flow, there's changes in energy delivery. So we can't stress the brain when it's already under tons of stress. And then after a couple of days, then we can start doing things that are going to be either palliative, meaning decreasing symptom load, but also restorative, meaning that we can start changing brain function, fixing the neck, and things like that. So what you would expect is from your chiropractor, from the sports guys that are on here, and gals, that when you go in to see them, they're going to do a really thorough history, ask you questions about what happened, how did you feel afterwards, what are the symptoms you've been having. They're going to do a physical examination, making sure that you didn't injure ligaments in your neck. And then they may look at your eye movements, they may look at your balance, and then make a decision off of, do you have primarily a neck problem, primarily a brain problem, and treat accordingly.
As we have moved through the understanding, the development, where chiropractic fits, and even the safety of having an adjustment, that becomes the impetus for having a healthcare provider that really understands you, does a really appropriate evidence-informed and research-based analysis on what we can do to help you. How does the adjustment impact concussions?
Oh, that's a really great question. Perfect, because you must have been reading my mind right there. And the third thing is, a good practitioner understands their tools. Right, you said understands the body, and they have to understand their tool, what their tool does. And more research is coming out between the work of Dr. Carrick, Dr. Heidi Havoc, all of these individuals showing about how chiropractic doesn't just move joints and make pops. We actually are affecting the brain with every intervention that we do. We're showing this on EEG, we're showing it on fMRIs, that after a manipulation or an adjustment, that there are changes in the brain. Those changes outlast the therapy. Sometimes hours, sometimes days. So we need to look at a chiropractic adjustment or a manipulation as a very powerful tool, almost kind of like the most powerful tool. And if somebody's very fragile, do you want to use the most powerful tool you have right there? Maybe, maybe not, really depends on the individual. Like you said, knowing your patient. Because when we manipulate a joint, whether it's an elbow or a wrist or a finger or a neck or a low back, we're stretching certain receptors that send electricity to our brain and help create protein. But if the factory can't produce the protein because it's injured, now you can cause more injury. Not in the sense that you'll become hurt, but you just won't get better.
Right. Yeah, that's a really good point. And I think it's fundamental as we start going through treating our body, knowing our body, and then reflecting on what's the injury that I just sustained, who's going to help me understand it, and then what can I do as a patient to not go backwards in my care, but actually continue to move forward. And one of the things that, as we look at concussion, it's kind of a layered onion. Like there's lots of layers to it, being able to properly diagnose and treat it. But let me ask you this. If you sustained a concussion when you were a young boy, and now you're an adult, okay, and you get another concussion, a lot of patients out there, and I know it's been a question that I have gotten in the past as well as a physician is, am I at more risk because I've had a previous concussion now that I'm an adult? And like, does the brain, and this is a very important question, does the brain heal itself?
I love the way you asked that question, and the answer is yes, absolutely. Just like a scar heals itself, just like a broken bone heals itself. But the scar tissue or the broken bone is not the tissue you originally wanted to have, right?
Right.
You know, God forbid something happened, I had a big cut on my face. That cut will heal, and I'll have a big scar on my face. Do I want the scar? No. I would want tissue back just the way it was. So healing is one thing, recovery is a different thing. My skin recovering would be back to exactly how it is right now. Our brain, the research, once again, supports that 27% of all concussions recover on their own without intervention.
Okay.
So 2 out of every 10. So that means 8 out of every 10 do not. And that may just alter your trajectory in life just a little bit. But however, like you were just talking about, extrapolating, 6 years old, my boys riding the dirt bikes, don't judge me, I'm not a hypocrite. I just want to say that, I will get back to what I was just saying, but my boys with their dirt bikes, they earn the right to ride faster, they earn the right to hit jumps by showing me that they have good form and good technique and they're responsible. So that's where we prevent things. And I think that this is important when it translates to our sports chiropractors with educating with football. Don't lead with your head, right? You know, this thing is sacred, make sure we take care of it. My boys understand that. But the idea being is that if we start going in that direction where patients, you know, have to prevent concussions and things of that nature, it's really important for us to have that special form. And I kind of forgot what my train of thought was. I said I was going to come back to it, but I forgot.
Okay, we were talking about that last piece, that as we were going in that responsibility is the healing pass, that it doesn't necessarily heal the same,
That's
but
right.
You said something really beautiful, the rehabilitation part.
Yeah, exactly. Okay, yeah, so that's right. 8 out of 10 people don't get better on their own, and they need help from somebody who's a trained provider. And your question was, is it kind of a cumulative? You know, throughout life, is if I have one at 6 years old, is going to affect me at 65 years old. And if it's not corrected, it potentially can. Now, there's no real way that we can look at these 80-year longitudinal studies to say, hey, that one time when you fell off your bicycle, that's the reason why you have Parkinson's disease, or you know, that one time you fell off your dirt bike when you were 10 years old, that's the reason why you now have multiple sclerosis. It's so hard to do that.
Sure.
But we have to think about it more of a theoretical perspective, that if your brain is working at a certain thing and only 2 out of 10 people get back to that without help, I think the reality is that every time you get a concussion, you need to get help.
I love that you said that, and I hope that opens up a door for you today, is that if you've been injured, sincerely seek the care that you need, because do you want the trajectory of your life to be impacted and not get the rehabilitation that you need and deserve? And I think everyone that sees a chiropractor will be able to have that assessment of range of motion, the flexibility, the stability, and the mobility that we deserve, because let's face it, if your head is on this little wobble board, it's a real thing. So I want to thank you, and thank you so much for sharing such incredible information, Dr. Antonucci. This is a moment for us to reflect on the ability for our bodies not only to be at optimum, but to heal from injury. So it's prevent first. Thank you, keep your boys safe. Optimize where you are so that you can ride those motocross bikes with the best opportunities, and then alleviate anything that does come your way. So today has been a very fantastic educational opportunity for you to understand the conversations going on around chiropractic care, and that there are myths that we need to dispel. Now, if you believe in advancing the chiropractic profession and making sure that the globe knows about these new and important research opportunities that are coming your way, well, we need you to help us get that word out and support us. We just got an update on our segment. We are now at $24,950.
Nice.
So thank you, Dr. Antonucci. We knew that you loved his information. We knew we were going to get closer to our goal this weekend. We are going to raise $75,000. That's our goal with your help. I know we can get there. Every dollar counts. And remember, your dollar will be matched by Foot Levelers, Biotics, and NCMIC, because those are the sponsors that are really truly stepping up. We've got plenty of sponsors that we've talked about over the weekend, but it's you that's making the difference. So thank you so much for donating, for joining us, and being part of the conversation. But we're not done yet, and the day's still young, so stick around because we'll be right back after this very short break.